Good afternoon, everybody, and thank you for joining today's briefing. As of today, we have had 1,062,300 cases, 3,413 new cases reported since yesterday, 1,580 people in the hospital, and sadly, 13,700 people who've died. Today's percent positive of cases is 12.2%, much higher than our 5% threshold, and our highest really since the winter surge. But today we do have some good news. I'm happy to announce the third winner of the Your Shot at a Million drawing. 18-year-old Audrey Chavis is from Winston-Salem, and her name was randomly drawn from the list of those vaccinated to be our latest North Carolina winner. Audrey plans to start her freshman year at Fayetteville State University this fall. She also works 2 jobs, but I'm thinking the sweepstakes win might give her a little leeway on that if she wants it. Audrey's with us today, and she's agreed to give us some of her thoughts. So Audrey, you want to come on up? I'd first like to ask you, Audrey, why did you choose to get vaccinated?
I chose to get vaccinated not only for the safety of other people around me, but simply for the safety of myself. When COVID first became big, it took away my senior year, and I saw how much it impacted everybody around me, all my fellow classmates, teachers, people around the world, and I saw how big of a deal it was. So not only did I want to get vaccinated for my own peace of mind, but for everyone around me who else could have been affected by COVID, anybody who has a sickness or something that could prohibit them from being able to live their life normally. I wanted to get vaccinated so I could be calm about going about my life and being able to get back to normal as soon as I possibly could.
So Audrey, I know you talked to a lot of people about this. What are the kinds of things you would say to people who are on the fence about getting this vaccination?
To the people who aren't sure whether they should get vaccinated or not, I would say I understand that there are people out there who are skeptical about what it could do to their bodies or how it could affect them negatively. But if you do your research and you take your time, the positive definitely outweighs the negative. There are way more pluses than minuses to getting your vaccination. It's easier to just get vaccinated and not have to worry about it than have to worry about constantly wearing a mask or putting yourself at risk, putting other people at risk. And it's easier to just listen to science and listen to the facts and just get vaccinated.
So Audrey, what was your reaction when you learned that you'd won $1 million?
My first reaction, honestly, it was pure shock. I had no other reaction than just absolute shock. I honestly didn't think that it was like a real thing. I kind of thought it was spam mail when I first saw it in my email. And it's still, honestly, I'm standing at this podium and it's still not clicking for me for some reason. I'm ecstatic, over the moon. I still have no words to describe like how happy I am. It's incredible for me, yeah, and it's indescribable, honestly.
So last question, I don't know if you know, but do you mind telling us what you plan to do with the money, if you do know?
So my main thing to do with the money is, number one, I'm going to use it to pay for school. I'm going to use it to get through my undergrads and my master's degree. I plan to major in psychology and become a family and marriage therapist. I'm sure I'll have some money left over. I plan on saving most of it, investing maybe 5 or 10% of it. And the rest of it, I don't know. I might treat myself to a shopping spree or something. I don't know. But most of it's going straight to my savings account. And if it's not for school or any other family emergencies, it's going straight to my savings.
Thanks so much for sharing your story, especially for getting vaccinated. I'd say it paid off in more ways than one for you. You're doing your part to end this pandemic, and we need more North Carolinians to follow your example. Thanks a bunch, Audrey. Appreciate it. Now we want to turn to our update. North Carolina's COVID-19 numbers continue to increase. But I can't stress this enough. The sharp rise in our numbers is driven by the unvaccinated. The data and the science are clear that getting a COVID vaccine dramatically lowers the chance of severe illness, hospitalization, and death. These vaccines are safe and effective, and they are the key to getting to the end of this pandemic. Last week, we announced that state government would begin verifying vaccination status for our state employees and executive cabinet agencies, and requiring anyone who's not vaccinated to be tested weekly and to wear a mask. That verification requirement takes effect September the 1st, and agencies are already starting to collect information from their employees. As a state employee myself, I've provided my vaccination card to the department. I've also strongly encouraged private businesses to do the same, and many are stepping up. A number of businesses are requiring vaccines for their workers, and I applaud that. We need all of us to come together and do what we can to increase our vaccination rate and stay safe from this disease. And that includes the private sector, nonprofits, doctors, schools, health departments. And as K through 12 schools prepare for the new school year, I encourage school boards to ask their staff and eligible students to get vaccinated as well. Positive news, in the last couple of weeks, we've seen a 42% increase in first shots. That's good, but we can't stop there. If you've gotten your shot, continue talking with your friends and family about why they need to get the vaccine too. I'd like to ask Cody Kinsley, our Chief Deputy Secretary of the North Carolina Department of Health and Human Services, to share a COVID update with us. Cody?
Thank you, Governor, and congratulations, Audrey. When you made the decision to get a COVID-19 vaccination, I'm sure you never imagined that you would win $1 billion in addition to protecting yourself, your family, and your community. I hope your story inspires more North Carolinians to get vaccinated, not just because of the money you won, but the way you made your decision by getting the facts about the safety and effectiveness of the COVID-19 vaccines. It is more important than ever that we encourage our friends, families, and neighbors with a simple message: don't wait to vaccinate. After months of decline, the highly contagious Delta variant is spreading rapidly in North Carolina, particularly among those that are unvaccinated. And unfortunately, younger people, those ages 18 to 49, make up 54% of the COVID-19 cases as of July 31st. If you are not vaccinated, you are at a greater risk for death and hospitalization due to the virus. This is completely preventable. Don't wait to vaccinate. Protect yourself and your community. Rigorous clinical trials among thousands of people ages 12 and older have proven that vaccines are safe and effective. Studies from across the world continue to reinforce that COVID-19 vaccines are incredibly effective at preventing severe disease, leading to hospitalization and death. Vaccination is how we end this pandemic and put our masks away. We need everyone eligible to step up and take their shot. Don't wait until it's too late. As Audrey said, learn the facts, trust science, and protect yourself. Please join the more than 165 million Americans that have been vaccinated. All COVID-19 vaccines are free. They are available near you, and there are people ready to help you with transportation if you need help getting to your appointment. You can get the facts and find your spot to take your shot at myspot.nc.gov or by calling 1-888-675-4567. If you are already vaccinated, thank you for doing your part. With most North Carolina counties in areas of high or substantial transmission, we recommend that everyone wear a mask in all public indoor spaces to help slow the spread of this highly contagious Delta variant. Please also talk to your friends, family, and neighbors who are not vaccinated. Help them understand why we need everyone to get vaccinated. Drive them to an appointment. In some locations, the person you take to an appointment can get a $100 summer card, and you can get $25 just for driving them. We need everyone to come together and help end this pandemic. Please, don't wait. Vaccinate.
Thanks, Cody. I want to turn now to the effects of the pandemic on North Carolina families and households. As the CDC's national evictions moratorium lapsed and President Biden put .nc.gov or call 888-9-ASK-HOPE to get help. We stood up this program from scratch last year, and it's helping people across the state stay in their homes with the lights on. The average turnaround time on claims is 2 to 3 weeks, and they are getting millions of dollars in assistance out every week. Since the HOPE program opened last fall, more than $328 million has been awarded to help North Carolina families, and over $234 million have already been paid to landlords and utility providers statewide. We've even asked landlords to identify some of their tenants who could benefit from this, and many of their tenants are signing up. I'd like to ask Laura Hogshead, our Chief Operating Officer of the North Carolina Office of Recovery and Resilience, to share an update on the HOPE program and how it can help. Laura?
Thank you, Governor. I'm honored to be here today on behalf of the North Carolina Housing Opportunities and Prevention of Evictions, or HOPE program. I am also pleased to announce that since opening last fall, HOPE has awarded more than $328 million in assistance, with $234 million already paid to landlords and utility providers statewide. In fact, as of yesterday, the second phase of the HOPE program marked a milestone with more than $100 million in payments since May 17th alone. But there are still many North Carolina families struggling to pay the rent, and HOPE is here to help. The HOPE program's mission is to provide housing stability during the COVID-19 pandemic by preventing evictions and utility disconnections. We are always evaluating the program to determine how we can better support North Carolina families. As a part of that process, after reviewing feedback from stakeholder groups and analyzing data from more than 57,000 applications, HOPE has recently implemented program changes that will expand landlord participation and increase the amount of assistance going to families across the state. As of last week, HOPE is accepting landlord referrals of tenants who need assistance. Through this program change, HOPE will be able to increase landlord participation in the program and continue to give a financial boost to landlords whose income was impacted by the pandemic. If you are a landlord whose tenant is struggling to pay rent, you can submit their name and contact information at the HOPE website, hope.nc.gov, or by calling 888-9-ASK-HOPE. A program specialist will follow up with the tenant and help them start the application process. In addition, the HOPE program has increased the cap on financial awards to applicants so we can provide as much assistance as possible while still meeting federal guidelines. The monthly rent award limit has increased by 30%, and the utility award limit has increased by 100% for all new applications as of August 1st. If you are a landlord whose tenants have fallen behind on rent due to the COVID-19 pandemic, refer them to the HOPE program. If you are a low-income renter who has lost income, been unemployed, or experienced any financial hardship due to the pandemic, I urge you to apply today. HOPE has streamlined the application process so you can easily apply at hope.nc.gov or by calling 888-9-ASK-HOPE. The call center has a team of English and Spanish-speaking program specialists that are on standby to assist anyone who calls. In addition, the turnaround time from application to payment is typically 14 to 18 days, so assistance for renters and landlords will come quickly. You do not have to be late on your rent when you apply in order to qualify for assistance. For people who have previously applied to the HOPE program, whether you received assistance or not, you can reapply during this application period if you still need help. Besides the HOPE program, 12 counties and 5 tribal governments are operating their own emergency rental assistance programs. If you're not sure which program serves your area, visit the website, hope.nc.gov, or again, call 888-9-ASK-HOPE for more information. On behalf of all the staff working behind the scenes on the HOPE program, we thank you for the opportunity to provide critical support during our state's recovery, and we look forward to continuing our service to North Carolina families in the months ahead. Thank you, sir.
Laura, thanks to you and your team for the hard work. Several months ago, an analysis showed that in states across the country, North Carolina during this pandemic had among the lowest COVID-related deaths as well as job losses per capita. In a difficult year, amid too much pain, saving lives and jobs has been a point of pride for our state. It shows that we follow the science to protect people's lives without losing sight of their livelihoods. It shows that we can come together, listen to health experts, get input from businesses, and then do the right thing. Now, as we seek to get more people vaccinated, it's time to come together again and focus on that common goal. With me today, Director of Emergency Management, Will Ray, Dr. Susan Consagra from the North Carolina Department of Health and Human Services, Brian Tipton and Lee Williamson are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. And of course, we have Chief Deputy Cody Kinsley and Laura Hogshead, the head of NCORE, here to answer questions as well. So we'll begin with questions from people in person here. Brian.
Hey, Governor, Brian Anderson here with the AP. Do you believe New York Governor Andrew Cuomo should resign?
The report from the New York Attorney General was troubling, and yes, I believe he should step aside.
And one question that I had was, you sort of referenced Biden's eviction moratorium announcement last night. Will you renew calls for the North Carolina Council of State to issue a statewide moratorium?
Well, as you know, I extended the eviction moratorium for North Carolina, but this is one of those executive orders that required the Council of State approval, and Republicans on the Council of State turned it down because they have the majority. We're going to review the Biden executive order. It's a little bit complicated. We're trying to figure out exactly who it helps, and we'll look at that to see what protection that provides. But in the meantime, we're pushing hard this HOPE program, which can help landlords and utility companies and the people stay at home and keep their lights on.
And is Audrey the third round of winners for the vaccine lottery? And where is the $125,000 scholarship recipient?
I'll let Cody, you want to answer that?
Sure. Thank you, Governor. Thanks for the question. We are still trying to get in contact with the education scholarship winner. And so by our rules, we have 30 days to connect with them. So hopefully, if you're out there getting emails like Audrey did, they're real, and get back to us. And then we'll be doing our drawing for the fourth round of winners today, actually. So.
One more for you and then one for the Governor. One check on school districts who have decided to have not mandated mask wearing is that there's an extra quarantine period if you don't wear masks in schools. Can you just sort of talk about the link between masking and the additional burden of increased quarantine time?
Sure. I mean, look, it is very important for folks to have in-classroom learning, and that's important to us. That's why we and the CDC have recommended masking. And so I hope that school districts continue to evaluate that, recognizing that people being out of the classroom is not what we want.
One more for the Governor, sorry. I was just curious, you've traversed the state frequently for vaccination events. Can you name one person or one story of someone you've talked to who has gotten the vaccine because of this lottery?
Oh, we've talked to a number of people who've said, yeah, if I can win, I want to do it. It's hard to know exactly what combination of factors draws people in to get vaccinated. And I think it's sort of one thing builds upon the other. And so as much information as we can get out there, as much incentive as we can get out there, the better off that we are. We did an analysis of the gift cards that we were giving out to get people vaccinated, and we did see an uptick there. So I think incentives do work, but hopefully now with people seeing the seriousness of this Delta variant, that more and more people are coming in. We have seen an uptick in our vaccinations, so it's good. Yes, sir.
Hi, Governor. Jonah Kaplan with ABC 11. Nice to see you in person again. Want to start with another New York story, which was in New York City coming out with a vaccine passport kind of making sure you're vaccinated to use gyms, indoor restaurants. Are you working on something statewide? And if not, what do you think if cities like Charlotte or Raleigh or Chapel Hill or Fayetteville and local governments, would you endorse them doing something like that?
So, we want to encourage businesses to do things that would get their employees vaccinated. And I applaud things getting their customers vaccinated. Some businesses have made the decision that we just want vaccinated people here so that we can tell all of our customers and our employees that they're going to be much safer because people are vaccinated. People have a vaccination card that employers can use or businesses can use. And we also have a vaccine verification process where people can go to the website and download verification of their vaccine if they got it here in North Carolina. And I can have Cody explain that if you want more detail on it. But I think you're going to see more and more businesses make this kind of decision. More and more employees are going to require vaccinations of their employees because they want their workplace safe. They want to make sure that people stay healthy.
Next question, I think for you or for Cody, what do we know about the people who are hospitalized? Not just their vaccination. I think the vast majority of people are unvaccinated, but are they, older? Are they seniors? Are they obese? What kind of comorbidities do they have? What kind of trends are we seeing, please?
I'll let you guys decide where you would want to do that. I'll introduce Dr. Susan Consagra from the Department of Health and Human Services. Dr. Consagra.
Thank you, Governor, and thank you for that question. So we are seeing an increase in hospitalizations across different age ranges, and we know part of the reason is because the Delta variant is much more contagious. It also may increase your likelihood of having more severe illness, and so that is leading to hospitalizations. We know generally people that are at higher risk of hospitalization are those that have other comorbidities, other chronic conditions that will then make them increase their severity of illness, and so we are seeing that across the board now as well.
The athletic people with nothing that are unvaccinated getting it, or is it people who sadly maybe are dealing with asthma who have other risk factors?
Yeah, in most
And Governor, finally, we tried the honor system at first, trying to say if you're vaccinated, you can take off the mask. Now you're trying with, giving out the incentives. At what point do we say, listen, if you're unvaccinated, this is the risk you live with? And for vaccinated people, look, it shows that you can deal with this. It could be just like the flu for a couple of days, but you're more likely to stay out of the hospital and, stay out of a worse outcome. At what point do we say, this is what we're going to do?
Look, we can't rest until this pandemic is behind us. And the only way that happens is that we get enough people vaccinated that we push this virus off the cliff. So we need to continue to do the things to try to get more people vaccinated because, yeah, you're making the decision not to be vaccinated, but what you're doing is you're putting everybody else at risk because you've made this decision, then you're continuing to foster this virus in the community. So we want to continue to do things that encourage people to get vaccinated, and we'll do that until this pandemic is behind us.
Thanks.
Yes.
Hi, I'm Rose Hoban, North Carolina Health News. So I'm curious, I guess this would be for someone from DHHS. Some of the areas of the state where the increases are higher are some of the same areas that have less hospital capacity. I'm thinking primarily like the Sandhills. What concerns about hospital capacity do you have, and what are you hearing from folks like at First Health of the Carolinas?
Well, first, we're constantly concerned about hospital capacity, and we have seen, I think, close to triple the number of people in the hospital over the last few weeks. We're up over 1,500 today. Hospitals have the ability to surge and to be able to create more room to take care of sick people. There are no hospitals at this time sounding alarm bells, but they remain concerned about this continuous increase and about how rapidly it occurs. But I know that the Department of Health and Human Services is in constant contact with our hospitals about this. You need to add anything to that, Cody? Okay. Dr. Consagra? Okay.
I do have a question for Cody, in particular about state-operated facilities. What is the vaccination status now of staff? We heard that there were some pretty eye-popping numbers of cases in some of the state-operated facilities earlier in the spring. What's the status of them now?
Great. Thanks for the question, Rose. I'm really proud of our team at the state-operated healthcare facilities. We have over 77% of our staff that have been fully vaccinated. And now we have over 95% of our residents or patients that are vaccinated. So it is really in that environment, as the governor said, well, push the pandemic off the cliff, but we need to get the remainder of the staff vaccinated. And so we continue to work in that direction.
As long as I've got you, we were hearing from some community health workers who are having trouble telling people to get a vaccine while also telling the vaxxed folks to mask up. So, there's a lot of mixed messaging. What are you doing to try and clarify that message for some of these folks who are having to disseminate it for you?
Yeah, I think it's important to remember that by far and away, vaccines are our best tool to fight this pandemic. At the same time, like in any other part of your life, driving a car, seatbelts, airbags, there's a number of measures that we put in place to try to control that risk. Right now, we have so much risk, but because we have so many unvaccinated people, just by getting that number down, that'll help us. And that's why vaccines are our most important tool right now.
And I just have a yes/no question for the governor. So there are never yes/no questions, but the Senate passed, is it Senate Bill 96 that would increase the ability for pharmacists to give injectable drugs, but it also restricts their ability to give COVID vaccines to teenagers. Would you sign it if it got to you? It's in the House now, but would you sign it if it came to you?
I'm not going to give you what you want. We're going to examine that legislation as it goes through the process. It does some important things that we know that we need to do. So we're going to continue to look at it. You guys are getting good at these 4- and 5-part questions here. I got it. Mr. Doran.
Hi, Governor Cooper. It's Will Doran from the News and Observer. I was wondering if we continue lagging a little bit on vaccinations, people are remaining resistant to get vaccinated. Is there a point where you consider bringing back, limitations on nursing home visitations, mask mandates, maybe even business shutdowns, anything like that?
I'll first say that the health and safety of North Carolinians remains the primary objective here. So all options are on the table. But we really believe that people now know what to do to protect themselves and other people. And our primary focus is going to be on vaccinations. That's what's going to get us at the end of the day. We don't want to do those other things if we don't have to. So we're going to continue making vaccinations the primary operations here.
Great. And I want to press the nursing home issue just a little bit more, because obviously we've seen that's where a lot of outbreaks have happened. Is there anything that the state should be doing to make sure that we don't see a second large spike from nursing homes as the Delta variant kind of rises here?
Well, if you guys want to, Dr. Consagra.
Thank you for that question. Yeah, for our nursing homes, we know that they are an incredibly high-risk population. And from the beginning, we have implemented, a multi-pronged strategy to assist nursing homes. And that goes from everything from infection prevention and making sure that the appropriate protocols are in place, to doing testing of staff, as well as now making sure that vaccines are readily available. And we are continuing to work with facilities across the state to make sure they have all the information they need for their employees, for their residents, to continue to increase vaccination rates. As the governor mentioned and Deputy Secretary Kinsley mentioned, vaccines are our way out of this pandemic. That is our number one priority, and we're going to continue to work with our facilities to make sure they're available. Thank you.
Adam?
Yeah, Adam Owens, WRL News. We just left as you may have seen on the way here, a bunch of healthcare workers downtown protesting, saying that whether or not they put the shot in their body should be their choice and that it shouldn't potentially cost them their job. What would you say to that?
That's so disappointing. If you are a healthcare provider working closely with patients and around patients who are often sick, it's your responsibility to get a vaccine. I appreciate their right to protest and their First Amendment right to protest. But I think that these healthcare facilities have made the right call in requiring employees to get vaccinated. And I hope that they will work to get the information and to be convinced that this is the right thing to do, not only for themselves and their families, but to the patients that they are supposed to treat and protect.
And the only other question is, piggybacking off his question about possibility of further restrictions, are there any trigger points, even if they're behind the scenes, that you guys have in mind that could trigger further restrictions at some point?
We are focused on vaccines, Adam. That's where we are right now, and we want to continue to push this. We're making some progress. The last couple of weeks, we've seen increases. So we're hoping that momentum can continue. Okay, we'll go to the phones if we have some people who have called in.
Our first question is from Richard Craver with the Winston-Salem Journal.
Yes, Governor, this is Richard Craver with the Winston-Salem Journal. We had a nursing home yesterday Arbor Acres announced that they were going to require mandated vaccinations for their employees. Do you anticipate that might spread to other nursing homes, long-term care facilities, and then would you recommend or advise that?
Yeah, I would support that. I think that we need to make sure that people who are treating patients and looking after them not only protect themselves, but protect patients. And, I realize that some of the healthcare facilities have to make tough calls because there can potentially be some shortages of staffing if enough people make the decision that they would rather leave their work than get a vaccination. So, these healthcare facilities have got to weigh those kinds of factors before they make those decisions. But I think moves that we make to get more people vaccinated are positive, particularly those who are in the healthcare arena. Next question, please.
Our next question is from Robin Kennedy with Fox 46.
Good afternoon, Governor. Wanted to ask if why you have not mandated masks in schools so far, if you are concerned about keeping students in person learning this year.
Well, we have strongly recommended that school boards require masking. The CDC recommendations say that, our doctors say that. We have a lot of evidence that schools are very safe when protection measures are taken, including masking. It is so important for our children to be in school in person. And taking that next step to make sure that you don't have to get students out of school because you have a lot of people infected. We've already seen that in some schools. That we want to try to avoid that. Now, the battle we are fighting most is vaccinations, and that's where we want to continue our focus. But a lot of school boards are stepping up and making the right calls. And as this Delta variant increases, we hope that some other school boards would reconsider what they have done and put in the mask requirement. Next question.
Follow-up, Robin Kennedy, Fox 46.
But Governor, why are you not mandating it?
I think everybody knows what to do. We've given the school systems the tools that they need to make these decisions in their local areas. We want to concentrate our efforts on vaccination, and that's what we're doing. Next question.
Our next question is from Laura Lee with Carolina Public Press.
Good afternoon, Governor. Laura Lee from Carolina Public Press.
I wanted to ask a follow-up to Rose's question. In terms of medical capacity to address the latest surge, beyond hospitals' abilities to increase, are you seeing issues with shortages of health professionals, nurses, doctors, and providers? And what do you have to address that in the longer term?
I'll let Cody Kinsley address that.
Thank you for the question. I think a lot of our healthcare systems across the state are seeing particularly difficult shortages in nursing and in other areas right now. And that has been driven by a number of factors. Our team is working hard to make sure we can support them. The good news is we're also working with the federal government. So whether we need to deploy additional staff, the federal government has offered resources as necessary. So we're actively monitoring that. We have a lot of resources in the state, of course. So part of it could be patient transfer and other things within region to try to help balance the workload. So there's a lot of tools that we have to try to manage that capacity need. But I think it goes back to the fact that, right now, for the next couple of weeks, our options are about managing staff and managing patient flow to make sure that everyone can get served by the specialist and the resources that they need. But we can get ahead of the next few weeks after that and the surge that may happen then if we can get folks vaccinated now. So if people are in their community and worried about their hospitals being overrun,
some differentiation in surging based on region, and we were tracking that with the county alert system for a while. I'm wondering if you are currently seeing what appears to be more widespread Delta variant, and if in the future you anticipate reinstituting a system where we may, consider different areas and the approach to mandates in different regions differently.
Right. So we are watching carefully at a regional basis. I think, as was pointed out earlier, we are seeing the current surges in our counties and communities with our lowest vaccination rate. That's perhaps without surprise. And so it's important for us to support those local hospitals there. I think, as we have found and learned in these last 18 months or so, that the virus does not respect regional borders that we create. It moves quickly and it moves across borders. And so we have to be forward thinking. We have to move fast in that direction. So I think that beyond thinking about regional controls, we are just trying to make sure that every hospital is prepared and that those local communities can get their vaccination rates as high as possible.
Next question, please.
Our next question is from Caroline Hicks with WBTV.
Hi, thank you for taking my question. We were hearing from a Union County school board member that he feels undocumented immigrants crossing the border are causing a rise in COVID cases since they aren't going through any screening and testing if they aren't coming through legally. Is that a concern from the state? And do you believe that that is worth discussing at a school board meeting?
I have no information that is occurring. I'm concerned about any person that is unvaccinated because unvaccinated people are causing a surge in this pandemic. I've said many times that we definitely need to fix immigration at the federal level, and I encourage our federal officials to come together and make sure that we have a system that works. Next question, please.
Our final question for today's media briefing will be from Anjali Patel with WLOS.
Hey, Governor, thanks for taking my question. Because school mask policies are pretty much up to each district right now, many parents are looking for virtual options in districts where masks are optional. Well, should school districts be forced to offer a virtual option for learning this year?
Well, I think that would be up to the school district. We are encouraging in-person learning for our students. It is so important that that happen, and we're going to continue to push in-person learning. I'll get you the answer as to whether there has to be a virtual option. Do you guys know the answer to that question? I'm not sure that we know that, but I know some schools are continuing to offer it for people in certain situations, but we'll try to get that answer for you. Thank you guys for being with us today. We appreciate it. Congratulations again, Audrey.